So, hi, good evening, friends. Dr. Mahesh Nair here once again with another cosmetic surgery topic, which I'm sure will be quite interesting for you because I have given it a lot of thought, and it came to me that I should be talking on this topic, wherein how should you, as a client or patient, plan your cosmetic or plastic surgery around your say work schedule or maybe your vacation or something that really matters to you, like your wedding or maybe even a long awaited get together wherein you need to look your finest. And how can you get the most out of your cosmetic surgery if you plan it well? Okay, so I'm Dr. Mahesh Nair, founder and director of Nepentake Aesthetics, Panampally Nagar, Cochin. And today we will touch upon this very important topic of planning your cosmetic surgery. So I know that the topic is a little not exactly vague, but it is a little offbeat. It is less technical. But as I explain you this topic, you'll come to know that it is pretty much technical, and it involves a lot of meticulous planning again. Okay, because it's all about planning. And trust me, in the medical fraternity also, plastic surgeons are renowned for their planning because our surgeries are very extensive, and they are generally conducted in stages as well. So we need to plan the last stage even when we are executing the first stage, so that we have our lifeboats ready during each surgery when we do, and we can anticipate what next we are going to do in the next surgery or the next procedure in the same patient, or how we are going to bring it all together. So it is very important for a plastic surgeon to have a foresight as to how I'm going to execute this surgery and the subsequent surgeries which are dependent on this surgery. Hence, planning is a very very important part of our curriculum. Nobody teaches it, but somehow we are either innately gifted with it, or we learn and cultivate this habit as we master this art of plastic surgery. It's a combination of art and science, so definitely planning is important to both. Even an artist plans, nothing goes without nothing goes without a proper plan. So I'm not saying that you should abide by to the T, but at least you have a scaffolding or a framework to work around with, and then you can improvise and change as you go ahead. So we need both things over here. One is flexibility in the plan, as well as a basic plan, a blueprint to work around with. So that's very important. And Yes. So I explained why plastic surgeons are good at planning, and why we generally believe in planning, because we require staged and extensive procedures. Like, for example, consider a mommy makeover. Okay, you come to us with all your queries, like, doctor, I need a breast lift, I need an arm lipo, I need a tummy tuck, I need a butt lift, or a thigh liposuction. How am I to go? So, given all these surgeries, of course, I will not try to combine all of them together. It will involve a lot of time, and your anesthesia time will go high. You will have a lot of hemoglobin drop, and so on and so forth. So keeping in mind your safety, which is paramount, before any cosmetic surgery, we always think of the safety of the client, because that is, of course, the most important thing for us. So keeping safety in mind, all these surgeries are planned. Say, like, for example, I wouldn't really combine a butt lift with a tummy tuck, because you're going to lie on your back after a tummy tuck, and your butt lift involves fat grafting to your butt, so that fat has to stay over there. So I can ask you to lie prone, I mean, that's on your tummy because your tummy has been operated upon. I can ask you to lie on your back because your back has been operated upon. So this kind of erroneous planning should be avoided, of course, because in a butt lift we also deal with the hip dips. So we cannot really ask you to sleep even on the sides. So then how will you sleep? So these are all very practical issues which the doctor, I mean, which a surgeon, especially a plastic surgeon, should discuss with his clients. I have the habit of delving into a little bit into the social surroundings of the client as well. Suppose if you're coming for a tummy tuck and you don't have any home help, or you don't have somebody to look after you in the post-operative period, it is going to be difficult, it is going to be challenging. And not warning a client as to what is going to happen with him or her after the surgery is something that is kind of a little unethical, I would say, because you have to look into the social arrangement of that person, whether that person can really take on that surgery, whether that person can really bring himself or herself out of it in a pleasant manner. See, eventually you're going to come out of it, I'm not saying no, but it should be in a nice manner. A cosmetic surgery should be a pleasurable experience to you. It should not be a traumatic experience. It should not be like, oh my god, what a harrowing experience I have had with this surgery, and I'm never going to undergo a cosmetic surgery ever again, because that is going to snowball into something bigger. You're going to tell 10 people, and then they're going to be averse to the idea of cosmetic surgery. So this kind of unpleasant scenarios can definitely be avoided with a little healthy communication between the doctor and the patient, and a good planning by the doctor with the patient in confidence. Okay, I cannot plan it without you. I cannot sit here and plan all the surgeries the way I want them to, because you may have something like your kid's open house, coming on the weekend. So I cannot plan things by keeping you in dark, like thinking like, oh my god, I didn't know that you had such and so and so an event, and I want to see you right now. No, that's not going to work that way in the present day. That really doesn't work. So we need kind of a meticulous planning around whatever we do, whatever it's like the doctor patient relationship is like a bond. It's like a permanent bond. An operation with me, or any cosmetic surgeon, or any surgeon for that matter, develops a bond with that surgeon, so that later on, if something happens, you can follow up, you can back up. And it's my moral duty to be in touch with you, so that I come to know what's happening with you and how you're taking it forward. Maybe I can add a little bit of input to it, and help you when it really matters the most. So these little things on a humane ground also take a long way. So it is not like buying a car, or even there is after sales, but it is mechanical. It's a machine. This is your body. So it can have certain things which are not related to the surgery also in the post operative period, and even that, to a certain extent, I can definitely help you with. Now, I was also being asked about this, ki why a standalone plastic surgery center is a good venture. Why? Because you don't have the mumbo jumbo of a corporate setup, where you have to run pillar to post, or maybe do the registration here, do the paperwork here, get the investigations done here. This is like everything under one roof. So it is a matter of convenience. It's a matter of luxury. Plastic cosmetic surgery is supposed to be a surgical domain of luxury. So when you get everything, all facilities under one roof, and you're not hassled by running around a lot, you feel privileged, you feel good, and that feel good factor takes you a long way through the what I can say, through the entire experience of the surgery. So you will not be having a bad taste in your mouth at the end of it, saying that, oh my god, okay, the doctor was good, the surgery was good, but the things around it were not that good. Like the room was shabby, or I was not catered to well, there was no staff to look after me. So in a standalone cosmetic surgical unit, it is like the entire staff, my staff, that is meant for you for that particular day. So, or maybe if you're staying overnight, for the next day too, including the night. So it is seen to it that you're catered to well, and kind of pampered, because that is the time when one is at their most vulnerable, and you need to have some kind of a support from the fellow humans around you. And these are all well trained staff who are trained to look after you in a particular way, scientific as well as humane. Not entirely scientific, like if I have told that this particular saline bottle has to go at night 2 o'clock, it does not mean that the nurse is going to come and wake you up at night 2 and then tell, I want to give you a saline just because the doctor asked me to. No, it can be timed strategically, so that your sleep is not disturbed in the post-operative phase, and you're taken care of. All these little things also require planning. So that's what I'm here to emphasize, how planning is important in cosmetic surgery, or any other surgery, or even your regular life. It's very important. So coming to the most commonly done cosmetic surgeries and their timelines, this is very important, because these questions keep coming up again and again. Like, especially I get these video consults, and there they ask me, like, doctor, I'm staying so and so over here, say maybe Australia or something, and I have got a 3 weeks holiday. Okay, can I do a 360-degree liposuction? Okay, fine. Primarily, prima facie, I might say yes, you might be able to do, because it's a 360-degree liposuction. You may be able to go home the same day or not, I don't know. So then I tell, like, okay, let me have a video consult at least. Corona at least taught us one thing, that many problems can be solved on video consultation, on Zoom or WhatsApp video, whatever the medium is. I need to at least see you in live motion. A video makes a lot of difference than a photograph. So the only hindrance being, it is always two-dimensional, and anything two-dimensional does not give us the depth perspective. So I will not be able to clearly understand how much of fat is there in your belly, or your love handle, or something like that. I will not be able to tell you very accurately how much fat is going to come out, or how long are you going to take to recover, because it all depends on the amount of fat. A 4 liter 360-degree liposuction recovers differently from an 8 liter 360-degree liposuction, for obvious reasons. I've taken on more fat, there has been more blood loss, more fluid electrolyte shifts, and your recovery time will obviously increase. So these little things add up to a lot, and that can increase your duration of stay in India. Okay, so I'm not just talking about overseas patients. I'm also talking about patients who stay a little bit far off, maybe another city, and they want to discuss their surgery with you before they actually come down for the surgery. So my sincere request to all people out there would be, if you're considering a cosmetic or plastic surgical intervention, please do not come on a flying horse. Why? Because the P in plastic stands for patience as well. So one has to be patient. Even the surgeon is patient, of course, with the with the outcome of the result, because many a times most of the plastic surgical procedures do not have instantaneous result. I'm not talking of surgeries like blepharoplasty, that is the eyelid surgery, or under eye surgery, or maybe cheek fat removal, or say otoplasty, where the ears are taken back. These are all surgeries with instant results. Okay, even gynecomastia for that matter, the primary result comes out very soon. But there are surgeries like this 360-degree liposuction, arm liposuction, thigh liposuction, a tummy tuck, or a rhinoplasty. They take some time to come out in the open and for them to be appreciated. So patience is a virtue, especially when it comes to cosmetic surgery, and it is very, very important that I emphasize on this, that one has to have sufficient time. Please do not pressurize your surgeon or your doctor that, doctor, I've got 1 week and you have to finish in this. No. To be very honest, I as a surgeon have refused several patients because of paucity of time. Why? Because my result will suffer because of that, and so will my reputation, because that suboptimal result will be seen by 10 other people, and they will feel that the result is really not up to the mark. Why should we choose this surgeon? That way, and this backdrop, the backdrop scenario never comes into the perspective as to whether there was enough time for recovery, was the person smoking after the surgery or not, and things like that. Are there any restrictions in our daily routine after cosmetic, and how many days rest do you advise? Yes, Anis, thank you for that question. I'm going to answer that question pertaining to different surgeries. The generally done surgery. It's not like I'm going to go to the rarest of the surgery, but at least the commonest of surgery, say like liposuction and all. I'm going to touch that surgery so that you come to know how much time you need before, during, and after the surgery, and how are you going to recover. How do you see yourself coming out of a 360-degree liposuction after the surgery? So I've made a small list over here. The first one being, of course, liposuction, which is the most commonest plastic surgical intervention which we do these days. And liposuction depends upon also the region. Okay, whether you're dealing with the arms, the chest for gynecomastia, the tummy, the back, where exactly. So primarily, I need a video consultation minimum, at least, to begin with. Why? Because I need to see you in dynamism when you're moving. Okay, I need to see how much fat is there, which is outside the musculature, especially in the tummy, which I can, get out with liposuction, or how much skin laxity is there, say in the arms. So I come to know whether this will really, make you happy. The liposuction for the arm will make you happy, or whether you need an arm lift, which means the skin removal surgery along with the fat removal. So this primarily I can judge with a video consult, and then I would like to see you in person to feel the tissues. We have this tactile feel of tissues, whether they are going to retract, or whether they're going to go back, whether the skin is going to go back, and how is it going to finally look. That is when these gray hair come into perspective, where our experience counts. So we have seen good quality skin, moderate quality skin, poor quality skin. So we tell you then and there, how we see this recovering, and that can give us a timeline whether you're going to take 2 weeks or 3 weeks. On an average, any liposuction, any region requires at least 10 to 14 days to recover. I'm not saying you need bed rest during those 10 to 14 days, but it is like the first 2 days at least you need good amount of rest. I don't expect you to run to a mall to do shopping or something like that, take sufficient rest. Be it like liposuction of the tummy, your arm, your thigh, wherever. Thigh, definitely it's going to pain you, because thigh is like the center of the body which is involved in all activities. Whether you're lying down, your thighs are there. Where you're sitting, your thighs are there. You're moving, your thighs move with you. So tummy is the region where you bend from. So you either bend to take something from the floor, or you turn around. So these kind of regions, you can't avoid them from movement. So give your body a little bit of rest, pamper yourself a little bit during this time, because it is the time of investment. It is going to give you rich dividends as you heal. And don't stress your body out during this time. Why? Because if you stress it this time, your recovery period will be prolonged. You will have a more protracted recovery period. Like, instead of recovering in 2 weeks, you will take 3 weeks. Why? Because the body wasn't given sufficient rest in the first 72 hours. So I would rather say, after any liposuction, 2 to 3 days are very crucial for rest. After that, say about 7 to 10 days on an average, or some liposuction, say like tummy and all, 10 to 14 days. After that, you can resume to most of your activities. Of course, I would not say something like weightlifting, heavy weightlifting, gymming, or something like that. Go a little slow on that. Cardio you may start after about 3 weeks, and full-fledged heavy duty weightlifting and all, you can start after maybe 6 weeks. Some surgeries like tummy tuck, you can start that after 3 months. So I'll come to that by and by. So here we are discussing just liposuction. So what is holding you back from performing all activities? That is because liposuction has some amount of discomfort that it generates, because you have a metal cannula that goes through the superficial layers of your body and takes out fat. Obviously, it causes some kind of micro trauma inside, and that causes some collateral damage along with the fat that is taken out. So hence the body requires some time to heal. Obviously, any surgery is a stress, bottom line. So your stress hormones are going to be in the picture, and they are going to take their own sweet time to settle the body. Of course, the body heals really fast. Trust me, the human body is a miracle in itself. 3 to 6 weeks and you're like back to normal. So that's why people, especially coming from abroad, ask me like, doctor, when can I fly out back after this, say, tummy lipo or back lipo, after arm lipo? So I would say, give me roughly about 2 weeks, and you will be in a position to go. If your timeline is very what I can say, constrained, and you still want a liposuction, then what we do is, we may not really go very aggressive with the liposuction. We go a little relaxed, but then we tell you that instead of removing say 4 liters from your body, we'll be just removing 3, so that your hemoglobin does not drop down that much, and you're in a position to go back faster. So there are these little adjustments that can be done. That is not an issue. Of course, the result also may differ with each case, with each scenario, but all these can be managed very efficiently with a good planning in and around the surgery. So normally speaking, for most of the surgeries, when I have had a video consultation before with the client, or a live consultation, I give them a set of blood tests that need to be done. We do those blood tests, and along with the chest X-ray, ECG, and whatever that's needed. Very minimal, nothing extensive, like maybe a 2D echo or something, very rarely, in very rare circumstances. So once that is done, we run it through our anesthesia team. So they give the pre-anesthesia checkup, and if anything is required at that point of time, we also ask the client to get that done, so that we come to know that you're fit for the surgery. That is of paramount importance. And once that is done, then we schedule the date according to your convenience and our schedule. So once that is done, the surgical date comes, you have the surgery, and then the convalescence starts, say like about a week, 2 weeks or something. For a surgery like say eyelid surgery, periorbital surgeries in and around the eye, upper eyelid, lower eyelid, say fat grafting to the eye, normally speaking 1 week is more than enough. You bounce back very soon. By 1 week, I remove the stitches, which are like the non-absorbable ones, and you're back to normal, with the result which is very evident in your face. Now, again, there are different surgeries over here. Blepharoplasties normally heal faster. If there is under eye fat grafting, that takes about 10 days at least to settle down completely. So 10 to 14 days sometimes. That depends who has what kind of a potential to swell up. So, and also that depends upon whether you have been having you have been smoking after the surgery or not. So generally we request you to avoid smoking and alcohol about at least 1 or 2 weeks before the surgery, and even about 3 or 4 weeks after the surgery. Why? Because both these agents have been known to affect your healing, your bleeding, your clotting time, so on and so forth. So these are detrimental. Of course, you can add e-cigarettes, vape, you can add hookah, you can add all these things to this, and they all somehow affect or impede your results from manifesting early. Another thing what we request you to do is stop your vitamin E supplements because they are known to cause excessive bleeding. Even regular usage of your green tea. Green tea is known to cause excessive bleeding. So we ask you to avoid all these things. Like some people have the habit of eating excessive garlic in their diet. So garlic, vitamin E supplements, green tea, ginseng, all these kind of products, some Ayurvedic medicines. These products basically promote more bleeding, and that may impede your recovery. Your result manifestation will be delayed, and then you will keep cribbing like, why my result is not evident, and why is it taking so long for my result? Doctor, can you please help me out with this? I get asked many a times, is there any cream or is there something that that can help me heal faster or something like that? No, I'm so sorry, there's no cream like that. And yeah, well, for the scar, we do have scar remodeling, gels and all, silicone sheets and all. They help, but they have their limitations. It's not like you just apply it and it's a miracle drug and you're gonna, heal in a day and things like that. No, that doesn't happen. So one has to be practical and patient as well again. So patient has to be a little patient, and even the surgeon has to be a little patient. So liposuction primarily on an average give me about 10 to 14 days, and you can be, on your in your regimen or in your routine soon enough. That does not mean you need to take off from work. That again depends what work you do. If you are, say like it's like a sedentary job, like a desk job, sitting in front of a laptop or something. Yes, you can begin from day 3, day 4, not an issue. Day 2 also sometimes. Gynecomastia guys begin from the next day itself. That's how quick the recovery is with our gynecomastia surgery. It's a keyhole surgery, so you are back on your feet almost instantaneously. And so is it for a breast augmentation with an implant. Okay, it's one of the quickest surgeries, and the downtime is very less. All you feel is a little heaviness in the chest when you have undergone a breast augmentation with an implant, and the recovery is really in a flash. Like day 2, day 3, my clients have like three generally. Normally they have like flown out back to whichever country they came from. So it's not something that because we take all absorbable stitches there, there's just a small dressing which is waterproof, so you don't have any major dressing issues or something. Of course, I can follow you up on a video call or a video chat, and we can discuss things over there if need be. Complication rate in these surgeries is extremely low, so we don't expect also something majorly to go wrong with these cases, and that generally helps. So these kind of things have to be thought of before the surgery. So one is liposuction, then tummy tuck. Yes, now tummy tuck, it's a major surgery, so we need at least something like 3 or 4 weeks in our hands. That also depends on your BMI, your body mass index. Okay, so if your body mass index is high, okay, that's your weight in kg divided by your height in square meters. Okay, meter square, not square meters, meter square. So yeah, so the thing is, if the BMI is high, say if to the tune of say 37, 38, 40, 42 and all, you're going to take more time to heal. As simple as it is. If you're leaner, if you're more closer to the ideal BMI of 24.9, 25, 26, the perfect bodies kind of just with a little bit of extra skin and a little bit of lipo here and there. I've done those kind of cases too. And trust me, those women have recovered really quick. Like, maybe in like 1 week or 2 weeks at the max. 1 week maybe an like an overstatement, but 2 weeks. And that's it. They can travel anywhere. They can do most of the stuff. The suture line heals really well. There is no gape. There is no infection. There's nothing. It's absolutely brilliant. The higher the BMI, the longer the recovery. That's why I roughly tell when I'm asked on, say, Instagram or somewhere, how long will I take to recover? And I've not even seen the patient, not even a photo of the tummy. Sometimes I get tummy photos which are like clothed and covered, and I don't know what Pandora's box is over there that when I open up and what am I going to see inside. So it's better that we have a video consult at least before a major surgery like this, or I need to see you in person, of course. So most of my international clients, when I see them, I have a rough idea as to how long they're going to take to recover and things like that. So I tell them, give me 1 month and then only come down. If you don't have it, please don't come down because it's of no use. I don't want to push you through something, as gruesome as a post-operative experience which is really bad, and you're like oozing fluid, and it's really not a very pleasant thing to do, and they'll get averse with the idea of any other cosmetic surgery. We don't want some scenario like that. So tummy tuck, yes, ladies, be very careful. Ladies, what, even men, like tummy tuck nowadays is a common procedure even in men. You have got a lot of belly fat, and you take out the fat, and then what happens is that the loose skin is there. Of course, it doesn't hang like an apron, because the pressure garment and all take care of it. But whatever the loose skin is there, we wait for about say 6 months to a year to see if it goes back. If it doesn't, you carve it out properly and you close it, and you get a nice flat abdomen, and that's how a tummy tuck works. So give me about 3 or 4 weeks, and I can assure you that your result will be delivered as promised. Rhinoplasty, another very very important procedure, and most commonly asked are two things: one, Dr. Cost, and second is how will be my recovery, how soon can I get back to both. So today only I had a client rather who has a timeline of say about 10 days, and he needs to recover and fly back. Now when I didn't commit anything, so when I first saw him, I'm like, okay, only these many jobs are needed in a rhinoplasty, uh, and hence your recovery will be faster, and you can fly in 10 days. But if somebody's nose I see, and I know that there are a lot of jobs involved in it, I will not tell 10 days. I'll tell, give me 2 weeks. That is 4 days extra. Give me 2 weeks, and then only I can, let you go away from me, kind of. Otherwise, I need to have you in and around me, so I can, give you a small plaster, give you a small dressing or something, and adjust the shape. Because rhinoplasty is a little moldable in the first 2-3 weeks after the surgery. After that, it is next to impossible to change the shape. Otherwise, you'll have to go do another rhinoplasty to get this rhinoplasty fixed. We avoid that kind of a circumstance, because primary rhinoplasty is the most important surgery, and should be the first and the last rhinoplasty that you do. Okay, because rhinoplasty results are generally permanent. It's not like at the age of say you did at the age of 25, and at the age of 40 your nose is going to look drastically different. It's going to sag down or something like a breast. No, it's going to stay there. It's going to change a little bit with age and aging, and that will suit your face. If it doesn't, that time then we can go in for a redo rhinoplasty. But prima facie, nothing's going to go wrong with it. That's like kind of an assurance that comes with the rhinoplasty. So give me about 2 weeks. Secondly, what I wanted to emphasize upon is cosmetic surgeries. Most of them are not like appendicectomy, okay, or say gallbladder removal. They're not a very standard, stereotypical textbook cookie cutter like appear this thing like surgeries. Like there are no graded steps. There are not like A to B has to go through this. It's not like a board exam paper where you need to write exactly like that, and then only you're going to get marks. No, that's wrong teaching. So plastic surgery is all about combining different procedures and executing those to the best in that particular case, so that you get the result that you expect. So rhinoplasty has a lot of small procedures in it, which when combined together form a rhinoplasty or a nose job. Okay, so that's why when you asked me the rate of my rhinoplasty, I cannot tell you that from a small Instagram DP pic over there, wherein your nose maybe in some awkward angle in some filter, and then it will be a wrong estimate. Of course, because if I tell you 60,000 and you come and tell me over your doctor that time, so you told 60, so it's not going to work that way. So I need to feel, see, assess, measure some things over there in your nose or in your face, your proportions, and then I can give you an estimate. So this is very very important to understand, because I get bombarded with questions like these. How much is my gynecomastia surgery going to cost? How much is this? People, before asking about the recovery, they ask about the money. I understand money is important. I'm not saying no, but value your body, value your result. That is very very important. Work towards it, work with me. I'm not saying I'm going to leave you after the surgery just like that, but work with me. And uh, these little things play a lot. I mean, they're very very important. You cannot just ignore them, kind of like okay, the cost is very less, so let's get the surgery done. See, surgeries like gynecomastia, which are a little cruder, and I can definitely tell sometimes, looking at the photo, that though it is deceptive, of course, because it's in 2D and I need to see in 3D. So whether what will be the rough cost and this and that. But if you ask me something like a rhinoplasty, that's really difficult, because we don't know how your nose actually feels. Looking at my nose, can you tell whether the skin over here is thick or thin? No, you cannot, because I need to touch it, I need to feel it, I need to feel how the cartilages are. It is not very easy to tell that on a video screen over here. So that's about rhinoplasty. Then eyelid surgeries, a live consultation or a video consultation, and roughly 1 week. Upper eyelid, lower eyelid, 1 week, when I say, it's not like you're going to lie on the bed for 1 week and recover. No, you're going to do everything what you're going to do from say day 2, day 3, and by 1 week is the time for your stitch removal, and then you're back to normal. That is what I mean by 1 week. Okay, it's not some bed rest or something like that. You can of course start all your day-to-day activities in about 2 3 days time, like your work from home, or maybe some desk jobs basically. But if you're like a civil engineer who wants to go to the site and work, then there may be some restrictions, of course. Like for example, hair transplant, okay, and the hair are just fresh over there, and you're going to wear a helmet over that. Why? So take a break at that point of time because you need it. Okay, coming to that, after eyelid surgery, yes, I had written hair transplant. So 1 week to 10 days. Don't fly in from some country and tell me like, doctor, I need a hair transplant. I want to spend some time with you. I want to understand why do you need it, what's going to happen, how I'm going to handhold you through the surgery and things like that. So I need at least 1 week after the surgery to just see how the grafts are settling, whether everything is fine. 1 week to 10 days, I wouldn't even say 1 week. Give me some time after that. Okay, I'll teach you how to use the shampoo after the surgery, how to ensure that the grafts don't fall, how to take care of the donor area. That all is very important. I can't just leave you to yourself, saying that okay, now you do whatever you want, and my job of grafting is over, now you take care of yourself. No, that doesn't work like that. My conscience will not permit me to do something like that. So that's with hair transplant. That's why I'm giving a little higher estimate, 1 week, 10 days, maybe 15 days or something like that, but not to scare you. Not like I'm asking you after a hair transplant, stay on me for 1 month and then I'm going to see how those hair come up. No, we don't need that much also. Most important next is fat grafting, which I very frequently do. Facial fat grafting, under eye, cheeks, temples, the hollowing of temples, maybe even forehead, to smoothen it, to make it look more rounded, especially in women. Then some women have those masculine foreheads, and then like this, so, and then you need to levelize, to make them leveled, or to make them more rounded. Then definitely you can do fat grafting in that instead of a bony surgery. And jawline sculpting with fat, lip fat grafting. So all these things. So facial fat grafting on an average takes about a week to 10 days to settle down, kind of, with the swelling coming out. Normally swelling and all comes down in 3 days, 3 to 4 days. Sometimes swelling may remain a little longer, we can't exactly predict. So we roughly give about 2 weeks, that much of margin for the swelling to come down. Sometimes in some people it lasts even 3 weeks. That does not mean that, see, medicine is not a math, where it is 2 plus 2 equals 4. 2 plus 2 can be 3.5, it can be 5.5. Each person's body, the physiology is different. One has to understand that what may make me sick may not make you sick. If you have a tendency to get cold, I may not have a tendency to get cold. So there are a lot of these little things that keep playing, and they finally affect the result, the outcome, the recovery period, and all that. So that has to be kept in mind. So facial fat grafting, roughly I say about 10 days is good enough. Breast and butt fat grafting definitely, Brazilian butt lift and all, give me at least 2 to 3 weeks for that fat to settle down, for that edema to come down. And you'll have to sleep on the tummy position for at least 2 weeks, so that the fat in the butt starts gaining some kind of nutrition from in and around and things like that. So that's very important. So one is butt lift. Then breast augmentation, flash surgery, trust me, with implant or even with fat grafting. Fat grafting takes a little longer, say about a week to 10 days to settle, but implant is like really fast, 3 days, and you're like mostly done. You don't need me again after that. So that's one quick in, quick out procedure. Gynecomastia again, 3 days. I don't really want more time, especially the lower grades, grade 2B and all, grade 2A, 2B. Grade 3 and 4, yes, I'll need about at least 5 to 6 days in the country or in the city. Like, don't fly out so soon. Be around me for some time. Let me have a look how it is settling. If there is a seroma, that is collection of fluid, let me put in a needle and tap it out. These little things can happen sometimes, and it's better that I, as a cosmetic surgeon, am around over there to cater to those needs at that point of time. There's no point in crying later, like, oh, I wish the doctor was closer, and I wish I had stayed there a little longer. Maybe this complication could be avoided. Yes, definitely it could have been avoided. Give me some time. So, and it's for you, it's for your body. You get this body only once in your lifetime. Pamper it, love it at least a little bit. I mean, like, don't sit on the couch eating burgers, but love it, respect it. That's what's necessary. Exercise it. uh, You'll realize that when your body starts giving way, and you feel that, you come to know, you have a realization that health is paramount to your existence. If you don't have health, Nothing else is important in your life. One day of just a headache and see how it debilitates you. One day of migraine. Ask anybody who has got a migraine. That one day which they lose their productivity. They cannot do a lot of stuff. They cannot bear a good. They cannot bear light. They cannot bear sound. As simple as migraine can lead to that. Imagine what happens with the rest of the body going awry. So gynecomastia. Then breast reduction. Breast reduction surgery, ladies. Give me 2 weeks. Don't ask me on Instagram, डॉक्टर कैन आई फ्लाई इन गेट द ब्रेस्ट रिडक्शन एंड मूव आउट इन 3 days. नो, बिल्कुल नहीं चलेगा. सो आई नीड एटलीस्ट 2 weeks because 10 days to 2 weeks. I wouldn't say really 2 weeks also. That depends upon the size of the reduction. If the breast is very large, like cup H, G, GHI and all, then you need longer time to recover, of course. So that's why I need 2 weeks. If the breast size is smaller, something like a double D or an E cup, and you want to go to a B cup, yes, then you'll recover faster. So then 10 days are enough, 7 to 10 days, because all stitches are absorbable. You don't need to come back for stitch removal. Maybe you need 1 or 2 dressings. That's all. Dressing, I can teach you in a sterile manner. You can do yourself at home because your breasts are in front and you can dress. You'll just need a helper. It's not like a back dressing wherein, somebody will have to dress you from the back. So these are all ergonomics which I can teach you, I can help you with, even your own dressings. Breast lift, again 10 days. Arm lipo, yes, very variable, trust me, because the amount of fat varies in everybody's arm. So you need 2 weeks to 1 month for sometimes for it to settle. Not that you will be like Thakur not working. You be using your arms from the very next day, I would say, but it will take some time to settle, and you need a little bit of a good garment to get the arm edema down. And so is for the thigh. Thigh lipo takes a good amount of time to settle. Please understand this. Thighs are a very dangerous territory. Not exactly dangerous from the surgical perspective, that all is fine, but from the recovery, they take anywhere from 4 to 6 weeks to just settle down. Okay, why? Because thighs seldom get rest. They are huge muscles. There is a good vasculature, good blood supply, and it takes a long time for it to settle down, mainly because it is involved in all activities. When you're sitting, your thighs are supporting your body. When you're walking, your thighs are being used. So thighs as such very rarely get rest unless when you're lying down. But again, lying down, one side is getting compressed, the other side is there. So one has to be a little careful with thigh lipo. That's why we don't go overtly overboard in taking out a lot of fat from the thighs in one go. Okay, not like not that I've not done. I've done even 10 liters of thigh liposuction, but then the downtime was more. The patient was feeling a little more lethargic for a little longer time, say like 2 to 3 weeks. Sometimes it even extends to 6 weeks. So thigh lipo, people be very patient. Then fillers and Botox. Yes, this is one very important thing. Threads, fillers, Botox. Guys, please don't come 2 days before the function and tell me, I want a Botox, I want a filler, doctor, do it now and let me go. No. Even sometimes we blunder on that, giving into the emotional aspect, like, oh, fine, you have got a garba dance or you have got a birthday party to attend, or this function is there, and we'll do a little bit of filler. By chance, if something goes wrong over there, say like a hematoma, a small blood clot or something, or a bruise, that's going to be there for about 10 days to 2 weeks. And there's nothing much that you can do about it except apply a cream and pray hard that it disappears before your function. So avoid doing that. Come at least 3 to 4 weeks before, or a minimum at least 2 weeks before. Give me at least 2 weeks. See, Botox anyway starts showing its effect at 2 weeks. I inject today, 10 days to 14 days later only the effect is going to come. So Botox needs some time. Fillers need some time. So all these things, even threads are a little better, but yeah, they can bruise sometimes. So all these things, now please do at least 10 days to 4 weeks. What I can say, 2 weeks to 4 weeks before your event, not very close to the event. I mean, there have been times where I have even refused to do it because the wedding function was just like 3 days away, and you want a filler in your lips, your under eyes, and all. I said like, no, I can't take this much risk. I'll have sleepless nights instead of you having sleepless nights. We can't do that. So don't come on a flying horse. And last but not the least, do not be scared. Even if it is the simplest doubt, it may sound very silly to you, but it may have a scientific basis, which you may not be aware of. But your doubt might have come from your subconscious, which is usually very clever. Trust me, every human has got a gut instinct, and that subconscious or the gut instinct is extremely intelligent, I would say, even in a low IQ person, to be very honest, because that is something that comes from your inside. And generally that instinct is correct. So do ask us doubts. Do ask doubts to the correct people. Don't ask a dermatological question to a gastroenterologist, or acidity question to a plastic surgeon, and do a little mix and match over there. Discuss with me whatever the issue is. I will seek the correct departmental help if needed. Say medicine, pulmonology, or rheumatology, or something like that. And I will tell you whether this is safe or not, or whether this is unsafe, or is the liposuction safe in a post bypass patient. So let us analyze you or decode you completely and then decide your safety. So discuss, and we can plan your surgery around, maybe if you have a 4 week vacation in which you want 1 week off for your family and then you want the surgery. So let us help you plan that, your vacation, so that you don't waste time with us and you enjoy your vacation and make the most of it. I know these days vacations come at a very great price. It is not very easy for anybody, be it a businessman, be it a professional, be it anybody for that matter. It doesn't, free time doesn't come easy, vacations don't come easy. So I respect that, and that's why we try to give you the best in that little point of time. So I hope this conversation has helped you guys to understand something about it. And if you have queries, feel free to ask in the comment section below, or give us a call at the numbers mentioned, and we'll definitely get in touch with you and answer more queries pertaining to cosmetic surgery, or even far away from it. No problem. Thank you guys for your patient listening, and I'll be back with something more informative in probably the next week. Okay, so take care, and goodbye. Thank you.